So someone wanted to know what's the difference between optic atrophy and optic pallor. And superficially they seem the same, but one is what we see pallor. We see the nerve looks pale. And the reason it looks pale is because normally the nerve is pink because it has little blood vessels on it and there's blood flow inside of it. And so that combination of the nerve fiber layer, the glial cells supporting it, and the blood vessels makes it look pink. So it's not completely red, but it's not completely white either. And when we have less red, we get pale. That pallor is the ophthalmoscopic finding in the pathologic process that we call optic atrophy. So optic atrophy causes optic pallor, and optic pallor represents what we see as the sign of optic atrophy. They're not the same thing. They're similar, but not the same. One's a pathology and the other is an ophthalmoscopic finding. And the reason it's important is something can look pale, but not be pale. And that's why when we see what we think is nerve pallor, we should not write that it's optic atrophy. You should write what you see, not what you think it is. And so one of my pet peeves is the doctor will write optic atrophy, but what they meant to write was optic pallor. Optic atrophy means you think it's pathologic. And so what we're looking for is evidence for optic nerve dysfunction. So we'd like to have decreased acuity or decreased visual field in a pattern that's compatible with optic nerve disease, a relative afferent pupillary defect. We'd like to have color vision affected, and OCT can see better than you can. And so to the micron level, the optical coherence tomography, the OCT can measure the nerve fiber layer thickness. And so if someone's nerve looks pale, and I'm wondering if it's really pale from optic atrophy, I'm going to check their acuity, their field, their pupil, their color vision. I'm going to do an OCT. What if their acuity, field are normal, there's no RAPD, the color vision is good, and the OCT says totally normal in the green zone nerve fiber layer? Then that is pseudo-pallor. It just looks pale. It's just physiologic pallor. And a lot of things can make things look pale, like the background, or they've had cataract extraction in one eye, or they're pseudophakic, etc. And that'll change what the nerve looks like. So looks pale and is pale are different. Is pale could be optic neuropathy. You must test clinically, and then we can adjudicate whether it actually is nerve fiber layer thinning with OCT, both on the nerve fiber layer and on the ganglion cell layer, where we can see the actual ganglion cell that's hooked up to that nerve. So one of the behavior changes that I hope you'll make as a result of this video is writing this question mark optic atrophy or question mark trace pallor. We should just make all of these go away. Instead of writing all these question marks, just write what you saw. It looked like temporal pallor, but I don't think it is pallor because they have a normal acuity field, no RAPD, normal color vision, and OCT of the nerve fiber layer and the ganglion cell layer are normal. That's look pale, but isn't pale. And that's the difference between optic pallor and optic atrophy.